My name is Dr. Wubetu Alebachew. I'm from Ethiopia, one of the country in East Africa. So I am a gynecologist with experience of 3 years and a fellow in infertility and reproductive endocrinology for the last 11 months. And I am a trainee in infertility in Indira IVF India for the last 3 months. So thank you. Infertility is still a big problem in our country because there are a few number of expertise. There are about probably 8 number of infertility experts and few number of centers, only one public IVF center. So the treatment options there are only, this is the only center and only few public IVF centers. So the country is big and people have to come from long distance to the capital city, Addis Ababa. So there are different challenges from the start of travel and also lack of centers, enough centers. So we have only one center which is giving for all services in only limited. So we have both human and other resource shortage. But there is a good start. Now we are improving. So the fellowship is started. So I hope it's improving. Well, this training is very important because, as I said before, there is a limited number of experts and the patient, the demand is too high. Still, there are a lot of patients waiting 6 months to 1 year waiting list to be evaluated and to get treatment for their IVF. So still there is high demand. This training I have got good knowledge, so I will be applying it. Also, I'm planning to have a new IVF and infertility center for a big university, University of Gondar. So the training, I am expected to do actually a lot of work after this training. So it's really helpful. So regarding to the perception or regarding infertility, how the community is perceiving, in previous days it was difficult to come to treatment because it's in the community it's considered something not treatable and it's also something seen or cursed. So people were ashamed or afraid of seeking health care. But nowadays, especially in the cities, there is good awareness improvement. Patients are requiring treatment, seeking, but in the rural area, remote from cities, still there could be still lack of awareness. There could be a need of giving information about infertility. So the training was good. I have got good knowledge. There was regarding especially the basic knowledge of endocrinology and infertility. I came in the big hospital. Indira is a big IVF hospital. It's well known in India, also in the world, I think. So that is a privilege to come here and to get an experience from it. And especially knowledge-wise, I have a good improvement. Maybe in practice hands-on part, that was kind of insufficient as to my understanding because I was a fellow in my hospital and doing procedures. I will advise, still there are a lot of people, also many gynecologists. This department is novel, so it needs more expertise, more trainees. They need to get the chance. So I have also many colleagues who are actually looking for getting this training, and I will advise they can apply, try, and if they get the chance to get the training wherever it is, and to help many couples, especially in our country, suffering from infertility. Well, I will be applying this training, especially I have got a good exposure to a new setup, regarding to ours. It's about 3 to 4 years. Our centers is around 4 years. But this one is has had a good experience. So I've got a good exposure of seeing the setup. How do they manage? How do they evaluate patients? Also their protocols. So I will be applying the new protocols, new knowledge, skill I have gained it. Definitely it will be helpful when I go back to my center. I would like to thank Merck Foundation because not only for giving me the chance, but also spending resource, money, and lots of things on infertility, reproductive problem, which is I consider is a neglected problem, especially in Africa, East Africa. Still there is a higher demand of experts, and also services must be expanded to East Africa. So Merck Foundation is doing a good job giving a chance of training, also capacity building, expanding centers. So I got this opportunity from Merck Foundation, and I would like to thank you. Ethiopia.